Hi you guys, welcome back to my channel. If you are new here, welcome. My name is Shayler and today's video will be my post-op update video on my ACL surgery. So I got ACL Reconstruction surgery on May 22nd, and so today would be 1 week and 4 days post-op, I believe. I just went to my post-op appointment with not my surgeon, but my physician's assistant. So I wanted to do an update. So disclaimer, I am not a professional. I am not a certified in anything. I didn't study in anything. This is solely from my own experience. And these are all my own opinions and my own experiences. So please take it with a grain of salt. Please consult a professional if you have any questions, concerns. Please seek a professional, okay? I'm not a professional. These are just my experiences and some tips that I have for you if you are going to be getting this surgery or thinking about getting this surgery. So let's go ahead and get into this update. So I did write down on my phone a few things that I wanted to say. This is kind of like a what to expect from my experience and some tips for you if you are going to be getting this surgery. Post-op, I was prescribed Norcos for pain. And they want you to stop taking it as soon as you start feeling better because they are an addictive drug. They can be an addictive drug. So I was only on the Norcos for about 3 days post-op. And that's because they made me really drowsy. And the first 3 days I was actually feeling pain in my knee because there's pain and then there's discomfort. And I was feeling pain, not discomfort. So I was feeling like sharp pains in my knee. So I ended up taking them for the first 3 days post-op. And then after that, I switched to my non-steroidal anti-inflammatory drugs, which are like your over-the-counter drugs. So I took ibuprofen for the swelling, not so much for the pain, because you kind of want to get the swelling down as soon as possible. So that leads to my second thing from what to expect is ice your knee as much as possible because it will be throbbing and it will be hot and it will be swollen. So ice it as much as you can. They say 20 minutes every hour or so, or as needed. So I definitely iced as much as I could because you want to get the swelling down. And I feel like the first few nights when I got back home from surgery, I did not get a good 8 hours sleep. I kept waking up every few hours because my knee was throbbing and it was hot and I would need to ice it. And then also you can elevate your knee also to help with the swelling. So because your foot also will be swollen, and if you elevate it, it helps the swelling go down because there's no way for it to travel. So that's why they want you to elevate it above your heart level. So I think they said about 12 inches above your heart level for the swelling to travel down to your body, and that's where it kind of that's where it exits your body. I don't know, that's what they say. I don't really elevate my knee, but you should. I think it helps a lot. I don't do it as much as I ice it just for convenience because you're laying down already most of the time, so I don't really want to elevate it because elevating is also 20 minutes for every hour. And I was told by my orthopedist that you can remove your brace because post-op they put you in a brace. You can remove your brace when you are idling, like if you're sitting down or if you're laying down and you're not moving your leg as much. Definitely remove your brace just for comfort, and also it helps you ice the knee better when you remove it. I didn't know that the first day, so I left it on for the first night. It was very uncomfortable, but it did stabilize my knee, which was nice. I was issued some blood clot sleeves. They're not socks. They're kind of like blood pressure sleeves. It looks like those. So what it is you Velcro it around your calves. And they give you two. They want you to do it on both legs. So, or I did. I got two. And you wrap it around and you turn on the machine. There's a button and a thing attached to it. You turn it on and it Every minute it like pumps air into the sleeve so that the sleeve like squeezes your calves so that it circulates your blood in your leg. I wore that like every night pretty much. I didn't do it when I was up and about because they want you to prevent blood clots. Usually you get them when you're inactive, so I wore them when I went to sleep. I think I only wore it for like the first week, just to be safe. I was already walking around by then, but just to be safe, like I wore my blood clot sleeves for about a week post-op. Another thing I experienced when post-surgery was that every time I got up from the bed, I would feel like this rush of blood just circulating down my knee, down my leg. Like you could feel it all just rushing down to your leg, because I feel like it just feels disconnected after the surgery. Your body just feels disconnected with your leg, like the rest of your leg, like knee down. When you are post-op, for me, they put a lot of gauze and dressing around my knee because they expect you to be having some bloody discharge. So when I took off my dressing, which I took off on day 4, usually they say you could take it off day 3, but I waited until day 4 just because I wanted to be safe and I was still feeling this gushing. So expect some gushing feelings, like you could feel the blood just coming out of your knee. That's what I felt. And so I waited until day 4 to take off my dressing. And when I did, there was a lot of bloody discharge. It actually leaked through to my wraps, which are the ACE bandages. They wrapped me up in 2 ACE bandages and a bunch of gauze. And it bled through to the ACE bandage, but it wasn't cause for concern. They expect you to be having bloody discharge, okay? If it's soaking like bloody, then definitely contact your surgeon. For me, post-op, when I was discharged from the surgery center, I don't recall seeing my surgeon. I'm sure he saw me, but I didn't remember that. I was given like absolutely no instructions for physical therapy. I've been seeing a lot of people who get the same surgery where they start physical therapy like right away, and that wasn't happening for me. Like everything that I was reading in the articles and everything that I was watching on YouTube or wherever I got information from, like it wasn't happening. So like some people got PT right away, like the day after surgery they're supposed to be doing this, or they've been giving machines where they can use to help them with range of motion like day 3, and I was given like absolutely none of that. So I was like, oh my god, am I gonna be behind? So I called my physician's office and they're like, yeah, they don't want you to do any PT until your post-op appointment. So I was actually surprised to find out that I wasn't going to be given any physical therapy until my post-op appointment, which was today, and that's 1 week and 3 days post, or 1 week and 4 days post-op. So I was actually surprised, and I was also a little bit concerned, but I was given no instructions for PT. Luckily, I had done some physical therapy prior to my surgery because when I got injured, I went to PT, and so I remember some of the moves from when I was there for my injury, and I just did what I could to help with the range of motion. Let me show you some of the moves that I actually ended up doing. So here's my surgical knee, and what they want you to do is, first of all, I put this my leggings under my knee. These are leggings that I just don't wear anymore. There's another pair and I'll show you the other move with those, but I put it under my knee just because your knee will not be flush with the floor like this one is. So first you want to flex your feet, and then they want you to flex your quad here. You see how it's flexing, and kind of have your knee like pushed down. Try to push it downward. So flex your knee, and then you're gonna push your knee down. You see how it's flexing like that? They want you to push it down, okay? And at the same time you flex your quad. So on this healthy leg, this is what it looks like that. They want you to do that pretty much. But obviously it's not going to look like that because you are still recovering. So just do what you can. And if anything feels uncomfortable, or if you don't feel like you're strong enough to do it, then definitely take it slow. Don't even do this move if you don't feel like it's something that you can even do, okay? Take your time, like don't even worry about it. Second move was basically just to take this out and just have it lie as flat as possible. And I just hold this for like maybe 5-10 minutes. It's not going to be flush with the ground. Like you could still see there's some space there, like this one where it's pretty much flat to the floor. It's not super flat, like I can still fit my fingers through. Whereas this one, it's pretty flat that my fingers can't go through. There's no space. So, you know, try to get it as flat as you can. And then the other move that I do, which I'm going to have to set down the camera. Sorry for the mess, but the other move that I do is I place my leg on top of this legging here. I can't lift my leg yet, which is one of the other moves they want you to do, is to do straight leg lifts. I cannot do that yet, so I'm not going to force myself to do it. You want like a slippery surface for your heel. These are called heel slides, and essentially what they want you to do is they want you to just slide your knee, your heel back and forth. And I use my other leggings here, and I place it under my hamstrings, not under your knee, under your hamstrings, okay? And what you do is you help this pull up, and you just go as far as you can. And for me right now, this is it. This is as far as I can go. We will get to where we can go all the way up, and that's just going to take some time, and that's just something you're going to have to deal with. But heel slides, basically you just go like that. You just slide it up and slide it back. Okay, so this is definitely progress from when I first got out of surgery. I think I started doing this like maybe 5 days post-op, and literally this is as far as I can get when I was 5 days post-op. That was it. But now I'm here, so there's progress. The way that I gauge how far my progress is I see how far up my heel slides up compared to my good leg. So how far it slides up my leg, like that's how I gauge how far it's gone. So when I first started, I literally only could slide it like this much, but now I'm like here. So this much, which is much better. Like there's definitely progress there. So for those exercises, I just do 10 reps and 3 sets, so 30 total. And another good one is just leg lifts, but on your side. But that's pretty much it for PT. I'm not doing very much other than that. Just a lot of walking around as well. That also helps. Right now, I'm still waiting to go into actual physical therapy with professional therapists to see what else I can do to help with the range of motion. And you always want to ice your knee after your therapy. It's also good to, if you have a heating pad, to kind of give it some heat before you start so that it can help loosen up, you know, all of your muscles and your ligaments to see your range of motion. And then afterward, ice it for 20 minutes. So moving on, what to expect. So they also gave me a prescription for it's to help with constipation, because the Norcos gives you constipation. If this is TMI, please fast forward, but I literally did not have a bowel movement until day 4 post-op. Also day 4, when I removed my dressings and I took off the tape that was on top of my incisions, everything looked fine. None of them were bleeding except for the really big one, because it's kind of like, you know, when you get a cut and you put a Band-Aid over it and then it scabs and then you peel off the Band-Aid, but it didn't heal completely. So when you peeled it off, the scab came off of the Band-Aid and then it kind of reopens the wound and it starts to bleed a little bit. That's what it was like. So I was still getting like a few drops of blood from my incisions coming out, which meant that I still could not take a shower, you guys. That's right, I did not take a shower for like 5 days. Yes. So on day 5, I finally did get to take a shower, but I used a waterproof bandage to go over my incisions so that it wouldn't get wet. And my swelling actually went down day 5. It looked like it was going down significantly. Day number 6 was the day that I got to shower without that waterproof bandage on my incisions, so that was nice. And then also day 6, I was experimenting with sleeping on my side because I was sleeping on my back for the first week post-op, which is very uncomfortable for me. I'm a belly sleeper, and also I was getting bed sores just from sleeping and sitting so much. So it was nice to sleep on my side. I feel like the little things you don't appreciate until like you can't do them. So when I was able to sleep on my side, I was like, yes. So that was exciting. And I still use my crutches, you guys. In my post-op appointment, the physician's assistant told me that I could use the crutch or the brace. I don't have to use both. And I also still wrapped my leg with the ACE bandage. I'm going to show you my brace. This is what it looks like. So it's just this humongous brace, okay? And this brace actually is what gave me my bruise on my knee, and I think also on my shins. Opens up like this, and there's little clasps right here that go around. They didn't adjust it well, so it was a bit tight. This is the adjustment for the what range you want your knee to bend. So I was told when I was issued this that I would never need to adjust it, and that the physician would adjust it, or the physical therapist would adjust it for me, depending on how far I can bend my knee and stuff. So I never touch that. I just adjust the straps to how tight it is, not for the range of motion. Okay, and then the crutches I use are these ones here. And it has these like U shape, goes under your armpit, and it has the handles here. This crutch is nice because it has that spring action, so when you put your weight on it, like if you put your weight on it, it goes up and down. Like you can see that it's already been going up and down because of the color there. Those are the crutches that I was issued, so I really like those crutches. I think that's it for my what to expect for 1 week and 4 days post-op. I don't think there was anything else that I wanted to address. Here's day 4 after I took off the dressings. And you can see here I'm taking a picture of my bruise that's starting to form from the brace. Here's day 5 or 6. The swelling you can see has gone down. And here's the bruise that's really starting to appear. Hi guys, I'm just hopping on here because some of my footage got erased, but I wanted to include my post-op appointment, how it went. When I got there, the assistant, the nurse, I don't know, she took out my sutures, and they were not painful at all, partially because a portion of my knee was numb, but it didn't feel like anything at all. No discomfort. I honestly didn't feel it at all because the sutures were so skinny. And after she was done taking them out, she put tape on it. I'll include a picture of it. But she took off she put some tape on it and some glue to hold it in place. And she told me I couldn't shower or get it wet for 48 hours and that they'll fall off on their own. So after she was done with that, then I saw the physician's assistant, not the orthopedist. He's like the second to the surgeon. He asked me how I was doing, and I said I was doing, I've seen better days. But he wanted to just check my range of motion, the swelling. He said it looked about, if he could estimate, it would be about 10 to 20 cc's. And that could be if you have like a kid's Tylenol syringe, or if you can imagine that, it's equivalent to like 10 milliliters or 20 milliliters, which actually isn't too bad considering it was probably a lot more post-surgery. But he said about 10 to 20
cc's, which is equivalent to milliliters. He was actually surprised that I could straighten my knee pretty well. Like it was almost flush to the floor, but not completely. Bending my knee, it was really limited, not that great. I had some questions and concerns. He said the numbness where I was feeling around my knee, it's normal because of the surgical site. They replaced my ACL with the patella tendon, which is that ligament that's in front of your knee where your kneecap is. And so he says that's normal. And then he also told me, like I said earlier, he said I could do crutches or a brace, one or the other. He also told me that the surgeon performed the ACL reconstruction. Apparently I had a lateral meniscus tear that he cleaned up. And then I think that was it for my appointment. And I have another follow-up in 4 weeks after I do some more PT. And I think that was it as far as my appointment. This is after the sutures were taken out, and this circle is where I'm feeling the numbness.